Meanwhile, Wisconsin continues to crawl toward herd immunity against the coronavirus as vaccination efforts continue across the state. At the same time, COVID case numbers are trending largely down and more of the state is opening back up. Many communities have already set dates for when COVID protocols will expire. In Milwaukee, the city of, that'll be June 1st. Dr. Joe McBride is with UW Health, and he joins us live this afternoon to talk about a number of these things. Doctor, thanks for your time. Let me just jump right in. We'll start with the spread of the virus. The statewide 7-day average for new daily cases now well below 400. It was double that, little more than a month ago. What does that tell you about where we are in Wisconsin right now?
I think it's a really wonderful start, and it really provides a lot of reassurance and sets the bar high for what these vaccines are able to do. I think once people see that more and more people are tolerating them very well, that they're effective, it's giving more and more people confidence to go out and get their shots.
Doctor, you mentioned the vaccine. I know you have a background in pediatrics as well. What are the concerns that parents are bringing to you as they decide whether or not to have their children vaccinated?
I think a lot of parents just want to know about the risk-benefit ratio for things like vaccination. You know, we've heard this whole year about how COVID is more severe in adults. And so they want to know, are the vaccines potentially worth the risk? And what we tell them is that it certainly is true that vaccines are an effective way to prevent and minimize risk of COVID-19, even for our pediatric patients. And that's why it's really exciting that we're able to offer it from 12 years and up from this point.
We're talking with Dr. Joe McBride of UW Health. Doctor, school districts are beginning to revisit their mask policies and COVID protocols. On the issue of masks, with staff largely vaccinated, or at least having had the opportunity to do so, and children, as you mentioned, if they do test positive for COVID, often aren't that sick themselves. Do you have guidance on what you would like to see school districts do for the remainder of the school year?
Well, I think it's really important to remember that we haven't had a lot of time yet for all of our adolescents to be vaccinated. So there still is a large part of our adolescents who want to be vaccinated and want to be protected that have yet to have that opportunity. And then, of course, there's a lot of kids in school under the age of 12, these elementary school kids, the middle school kids, and so they're not yet eligible till we have more information on how to dose the vaccine properly in this age group. So the large swath of all of our school-age children still are vulnerable to it. And while it's less severe in pediatric patients, it's still nothing to sneeze at. You know, there are 16,000 hospitalizations to pediatric COVID. There's been over 300 deaths in the country so far, and these will soon be preventable illnesses by vaccine. So we're getting close, but I would recommend anybody who's unvaccinated, and that includes people under the age of 11, to remain in masks and to continue their social distancing.
Doctor, I wanted to make sure to get this in. I know we're out of time and they're hollering at me to wrap up. But, you know, one of the things that we are hearing from parents is they're seeing other problems with their children, and they are attaching that to mask wearing and COVID protocol. Things like depression, things like not feeling motivated, things like underperforming. How do you balance that with the concern of not wanting to transmit COVID, but also the overall health of our children?
Oh boy, you really brought up an important part. I mean, think about all the suffering that we as a country have gone through, and the kids are such a huge part of that. So we really owe it to them to be able to get through this pandemic as quickly and effectively as possible, and continued vigilance and getting the vaccine is the way that we can do that the quickest.
All right, Dr. McBride, so much appreciate your time this afternoon. Thank you for joining us.
Thanks for having me.